My hair is at a really fun length, but we're looking at the COVID CDC guidance. For COVID isolation, it's now grouped all within the respiratory virus guidance, where they keep reiterating their propaganda of we have more and better tools in the fight against serious respiratory illness. Because COVID vaccines cut the risk of severe disease in half, and over 95% of hospitalized adults were not up to date with their COVID vaccines in fall 2023. Neglecting the fact that after 4 months, this reduced risk of about 61% of severe illness is only at about 22% in immune-competent adults, where 17% of adults got vaccinated 2 years ago, and about 21% of adults got vaccinated this past year, and that's a loose estimate because we're no longer tracking that. Because effective treatments are also widely available, like Paxlovid. But Paxlovid is contraindicated with many different medications. If you're a child under 12 years of age, you can't take it. If you're under a certain weight limit, you can't take it. If you have a dairy allergy, you can't take it. It's $1,400 without insurance. And the 5-day duration of treatment is too short. And they claim that population immunity to COVID is high. But while vaccination provides broadened protection against the many different variants, getting infected with COVID does not. It provides a focused immunity to that one variant you were protected with. It's not providing cross-protection like the vaccines do. In addition to T-cell dysregulation, so you're actually not even mounting an appropriate response to what you were infected with. You're getting less of a response than you would if you just got the vaccine. They claim that fewer people are getting seriously ill from COVID, and there are fewer hospitalizations and deaths, which may be true, but the hospitalizations are definitely undercounted, as are the deaths. And from the data we do have, we were having about 2,000 deaths a week from COVID. Additionally, the CDC claims that the prevalence of long COVID is going down, but I have not seen evidence to support that statement. I've actually seen evidence for the opposite trend, where the incidence of long COVID is going up, and that this increases with each successive infection of COVID. And outside of this false statement right here, it's neglecting the chronic disabilities that are being generated from this disease itself. These aren't being factored into the considerations. So while they say that COVID-19 is now increasingly similar to other respiratory viruses like the flu, this is not true. This is a false statement. COVID is worse, it's more severe, and it is more debilitating. It has systemic impacts on your entire body, and we are still learning new things to this day in year 5. So because of all the statements they provided, they're saying this is justification to change the isolation period for COVID, giving a blanket respiratory virus guidance that people stay home and away from others until at least 24 hours after both their symptoms are getting better overall, and they have not had a fever and are not using fever-reducing medications. This is obviously very weak language, and is essentially saying it's fine if you go into work, so long as you're just a little sick. Part of the problem is that not everyone that gets COVID has a fever. While fever is one of the symptoms, a lot more often it's cough, fatigue, muscle and body aches, headache, sore throat, congestion or runny nose, nausea, vomiting, diarrhea, but they're just focusing on fever. The next issue is feeling better overall, which is completely subjective. So extreme case scenario, you stay home for a day, where most people have COVID persisting for between 4 and 16 days. So with this strategy, there is no disease prevention, there is no disease mitigation. You're just literally allowing people to come into work sick, spread COVID, and let it transmit to everyone. Where they then encourage individual responsibility of people, suggesting you take steps for cleaner air in your home, enhancing your hygiene practices, wearing a well-fitting mask, and keeping distance from others, and getting tested for respiratory viruses. Where part of the reason from this guidance is that the CDC had to consider other factors, such as the personal and societal costs of extended isolation, so business pressures. And this sentence about the timing of when people are most likely to spread the virus, which they say is a few days before and after symptoms appear, is laughable, because we know that this duration of time is much longer than the 24 hours proposed. Because while they threw in this disclaimer that the duration here given could be shorter, longer, or the same as previous guidance for COVID-19, we all know that businesses are not going to respect this down here and are going to say, oh, are you feeling better after 24 hours of starting illness? Okay, come on in. Additionally, they are no longer recommending testing for what you're sick with. They're just saying testing is an option that you can do during your 5 days of additional precautions after this 24-hour waiting period. But then they'll go on to say, oh, well, people aren't testing anymore. when the government is not providing tests to the people. They're completely outdated. They haven't been updated since day one. They're relatively expensive. Best case, I can get a 5-pack of FlowFlex for like $32. And then if testing isn't recommended, how are you going to know if you should be taking Tamiflu or Paxlovid for the people that can take those? And furthermore, without the testing, how are you going to prove disability once you are disabled by COVID? How are you going to get your insurance coverage for this without the proof of test? And why have other countries for years had a 3-in-1 rapid test that they can use for COVID, flu, and RSV, and we just got our first 2-in-1 COVID and flu test for rapid testing, the ones that are cheaper and more readily available to people? The sliver of good news is that this doesn't apply to healthcare settings. However, those are weak to begin with because asymptomatic healthcare providers with higher risk exposures do not require work restriction. Where currently healthcare practitioners that have mild to moderate illness and are not severely immunocompromised or moderately immunocompromised need 3 of the following. So at minimum, 7 days have passed since symptoms first appeared if they get a negative test. If they didn't do a COVID test, then they have to wait 10 days. And this has to be concurrent with not having a fever for 24 hours and then not having symptoms, or at least having symptoms improved. Examples are cough and shortness of breath. So all 3 of these have to exist for them to be able to go back to work, with this being longer for those that have severe to critical illness. And for schools, this won't go into effect until the 2024-2025 school year, which would be in the fall. But then they do intend to align it with these updated respiratory virus guidelines, so this document here. Fascinatingly, they're leading with their whole chest, saying, "We do not expect an increase in COVID hospitalizations and deaths as a result of this updated guidance." So we're going to hold you to this one. We're going to hold you to it, Mandy. And yes, we are aware that in April, hospitals will no longer be recording COVID hospitalizations. That as a result of the end of the public health emergency declaration. So you can't use those numbers to justify it next year.